This is Auntie Lena. Hi, YouTubers. I'm actually coming to you to. Let me adjust my camera. I'm actually coming to you today to talk to you briefly. I had said in one of my short videos a while back that I would be talking to you guys about Bell's palsy and braces. So I'm going to do that today. What Bell's palsy is it's a temporary paralyzation of one side of your face. A lot of people like to call them mini strokes. I don't like to call them mini strokes because they simply aren't. Strokes are only caused from one thing, and that's trauma to your brainstem. And Bell's palsy is caused by several things. It's actually considered a viral infection. It can be caused by stress, ear infection, sinus infection. Mine actually came from stress. During that time, I was going through a divorce, and I was really working hard, trying to figure out how I was going to handle houses and cars and all this stuff. My dad actually had Bell's palsy twice. The first time was as a result of the mumps, which was when I was a little baby. It's like 1971. The second time he had it was a few years back. It was as a result of an ear infection. And the first thing that the doctor asked him was, what type of work did he do? And he mentioned that he was a truck driver, and she asked him if he drove with the window down, and he said yes. So the first time it was on, the very first time back in the early 70s, it was on one side of his face, and then a few years back when it happened again, as a result of him driving with the window down, he accumulated a ear infection, and it happened actually on the opposite side. So he's actually had it on both sides. It is not hereditary. So you can't catch it if your parents have had it. It's simply a case-by-case basis. My cousin's girlfriend actually had it as a result of swollen sinuses. Her sinuses began to press on a nerve, on a nerve or something, and they said her sinus was swollen, and it caused her to have Bell's palsy. Recuperation cannot be forced. It just has to happen. I actually had to go to physical therapy 3 times a week, take steroids, which caused me to gain weight. And actually that was in August of '05. By December '05, I had 100% restoration. I had to wear eye patch at night, put eye drops in my eyes, because your body goes into self-defense mode, and since you don't have voluntary movement, your eyelid doesn't close on your eye. So you have to put eye drops and wear eye patch at night so that your eye doesn't dry out. If your eye dries out, you go blind. So again, by December, I had 100% restoration. By February of '06, I had to have my gallbladder removed. And because I'd never been in the hospital for any kind of surgeries or anything, I was so scared of what was going to happen as a result of the surgery that I forgot to ask my surgeon if any of the anesthesia or pain medication was going to affect the fact that I had just recovered 100% from Bell's palsy. So as a result of me not getting any information because of my fears, I ended up going through all of that, and I didn't even think about it until I was in the recovery room after my surgery, and it probably knocked out maybe like 20% of 20% of the 100% that I gained back. So I think too, I'm not sure because I haven't done my homework, but I do think that in the recovery process of Bell's palsy, because you haven't used those muscles in a while, I think once they do become active again, I think that they are a little shorter, because now when I blink, it happened on this side, so it's like now when I blink, I have kind of a little twitch, so my mouth moves like this. But I think because all of this is connected together. Everything from above your eyebrow all the way down is connected together, and I found that out during my physical therapy. They put little pads here and there, and you realize that all this is connected when it was called electrotherapy. So they just sent electricity through my face to kind of jumpstart the nerves that were paralyzed. So a lot of times when I blink, my mouth will tend to twitch like this, as does my father. And I know sometimes when my face gets tired, my face tends to pull to the side. So I try to, every now and then I try to massage it and relax it. It's 4 years out now. It's almost 4.5 years out by January. So I've just been dealing with it. A lot of times people ask me, well, what's wrong with your eye? And it's not really my eye. It's the muscles that are on this side of my face that are slightly weak. So I would just say exercise, diet. Try your best to stay stress-free. Try your best to take daily vitamins so that you can fight off bacteria. And that's about it. You don't lose any, none of the rest of your body gets paralyzed. It's just either side of your face that it happens. So sometimes if you see me talking like this is the side that works. This is the side that was affected. So like I said, when I get tired, my face tends to pull this way a little bit, but that's just a side effect. I used to be really self-conscious about it, but now I've learned to embrace it, and I actually wish there was some kind of foundation or support group for people who actually have to deal with Bell's palsy, because it is a very humbling experience. And if you're a person that is slightly vain, or you use your appearance as part of your job, it can be a little difficult to cope with. I sing, so I had to deal with speech. I had to overcome the fact that I felt like everybody was looking at me every time I grabbed the mic. I actually wore shades for 3 months to church and everything. It's just it's something that that you really have to deal with. Like I said, I wish there was a support group or some kind of foundation that deals with that, and if there isn't, maybe I'll start one. So I just want to give you a little information on that. I'm pretty sure at some point people are going to ask, why is her mouth crooked? Has she had a stroke? No, I haven't had a stroke, but I did have Bell's palsy. So until next time, I'm not sure what my next video will be, but until next time, this is Auntie Lena. Thanks, YouTube.